Maxillary permanent central incisor. Introduction, various aspects, the label, lingual, mesial, distal, and incisal aspect, and summary to the maxillary permanent central incisor. What are the general features of an incisor? Incisors means they are shearing or cutting teeth. So maxillary incisors are 4 in number. In that 2 are the lateral incisors and 2 are central incisor. So these 2 central incisors, they are seen on either side of the midline. And this is the only tooth with the mesial surface of each tooth are in contact with each other. So this is the most prominent tooth in oral cavity, and central incisors are also known as first incisors. This is the widest tooth in the anterior segment. The next slide, this shows a pictorial representation of various aspects of the tooth. It shows the labial, lingual, mesial, distal, and incisal aspect. And some areas, some aspects of the tooth are highlighted over here. The labial aspect, that is 2 highlighted areas are there. The mesial side shows the mesioincisal angle, and the distal, that is the left side, shows the distal incisal angle. Coming to the lingual aspect, the highlighted area is also called as the cingulum. That is the characteristic feature of that aspect. Then the mesial aspect, 2 highlighted areas are there. That is your cervical line and the developmental depression that is seen on the root. When you look at the cervical line carefully, you can make out the mesial aspect. The cervical line seen on the mesial aspect is deeper than compared to that of the distal aspect. And the next highlighted area, that is the developmental depression. And the incisor aspect shows the incisor edge is highlighted over here. So these are the various aspects of the maxillary central incisor. So before we move on to the description of the tooth, we need to know the surfaces of the teeth. So if you divide the quadrants, if you divide the jaws into various quadrants, so you can draw 2 lines, that is a vertical line and a horizontal line. So what is a vertical line? A vertical line is drawn vertically through the midline. It also represents the midline. So that divides the jaws into right and left sides. And there is a horizontal line that represents the occlusal plane, and this is seen at the level of the occlusal surface of the teeth. So with this midline and the occlusal plane, that is the vertical line and the horizontal line, we are dividing the jaws into 4 quadrants. So these 4 quadrants are upper right, upper left, lower right, and the lower left. Now coming to each surfaces of the tooth, that is the mesial surface, the distal, occlusal surface, buccal surface, and the palatal surface, incisal surface. So when you learn each aspect of the tooth, you need to know the surface of the teeth also. The mesial surface, the side of the tooth that is facing the midline. So all the teeth which is there in the quadrant, if it is facing towards the midline, you call it as the mesial aspect. The distal surface, the side of the tooth that is away from the midline, that is called as the distal surface. Occlusal surface, the surface of the tooth that occludes with the opposes with the opposing tooth of the opposing jaw, they are called as the occlusal surface. And buccal and the labial surface, the surface of the tooth that is facing the posterior teeth, the surface of the posterior teeth that is facing the cheek, that is called as the buccal surface, and the surface of the anterior teeth that is facing the lips, that is called as the labial surface. So when you go on to the next, that is the lingual surface and the surface, that is the surface of the lower teeth that is facing the tongue, that is called as the lingual surface, and surface of the upper teeth toward the palate, that is called the palatal surface. Now coming to incisal edge, so that is the cutting end of the anterior teeth. As you age, the incisal aspect of the tooth becomes more sharpened. So 2 surfaces, when they meet in this condition, then it called as an edge. So since we are talking about the edge over here, you need to know about the incisal ridge also. So as soon as when a tooth, the permanent tooth erupts in the oral cavity, the surface, that is the incisal aspect, will be more rounded in the incisal portion. And it also, the labial and the lingual surfaces merges together with the distal incisal and mesioincisal angles also, and together this portion of the tooth is called as the incisal ridge. It is more rounded in case of the ridge, and the edge will be more sharpened. So that angle which is formed by the 2 sharpened surfaces, that is called the 2 surfaces, to form a sharp angle, that is called as the incisal edge. This picture shows the incisal labial aspect of a tooth. And so that is 2 arrows which represents the 2, 1 and 1, 1 of the oral cavity. And in insert you can see the extracted central incisor. This is 2, 1. You can actually compare the angles that is the mesoincisal as well as the distal incisal angle. The mesoincisal angle is more sharpened and the distal incisal angle is rounded. So for a newly erupted tooth, as we said about the incisal edge over here and the ridge over here, in incisal, the newly erupted tooth shows developmental mamelons also. So these are the three protuberances what you see on the tooth surfaces. So these are seen on the incisal ridge of the newly erupted tooth, and in this, the middle one will be the smallest one. And even on the labial surface, you can see some developmental lines on the labial surface also. So that divides the tooth into three parts. And this mamelons actually represents the developmental nerves. So, and as we already said, this is the most prominent teeth in the mouth. And that was the labial aspect. And when you open the mouth, the palatal aspect of the tooth, that is what you are seeing right now. This is the palatal surface of the tooth. So now at least you can make out which is called as the labial aspect and which is the palatal aspect of the tooth. Since it is the nasal and the distal surfaces are not visible, we can't appreciate them. We have kept two extracted tooth over here, the distal and the mesial. The distal one, if you compare the tooth, there are only two, the bulkier, mesial aspect looks more bulkier, as well as if you look at cervical line, by now you should be knowing cervical line. Cervical line is much more deeper in case of the mesial aspect compared to that of the distal one. Now we'll go on to each aspect in detail. So the labial aspect, crown appears more smoother and it is convex with the flat middle and incisal portions. So, and it is more of a squarish or rectangular shaped tooth. And mamelons are, as already I said, mamelons will be seen in the newly erupted tooth. Now it is not seen in this inset picture. And average length of a crown length is 10.05 mm, 10 mm, and the mesodistal dimension, that is 8.5 mm. You'll have a sharp mesoincisal angle and a rounded distal incisal angle. The nasal outline is slightly convex with the crest of curvature, that is the highest point that approaches the mesoincisal angle. And the distal incisal angle also is more convex compared to the nasal outline. Nasal outline, they say, even though it is convex, it is more of a straight line. And you can see a single root that is tapering, and it will have a blunt apex. Now, continuing with the description of the labial aspect, the incisal outline is irregular and it is straight in the mesodistal direction. The incisal outline tend to curve towards the center, showing that crown length will be greater in the center. The cervical outline shows a circular shape with the direction towards the roots and the curvature that is convex. The convexity is facing the root. And the root is cone-shaped with the blunt apex, and the crown is 2 mm. The root is 2 mm longer than that of the crown. So if you draw a line through the center of the root that is crossing the crown, it tends to be parallel with the nasal outline of the crown. And so that is the description of the labial aspect. So when you look at this picture, you can appreciate all the points which we described earlier. The mesoincisal angle, the distal incisal angle. Mesoincisal angle is more sharper than the distal incisal angle, which is more rounded. If you look at the nasal outline, it is much more straighter, even though it's convex, it appears convex, it is straight. Distal incisal angle is more convex than that of the nasal outline. You can see a semicircular shape is a cervical line and a single root with a blunt apex. So almost the surface is smooth and convex, and the shape is rectangular to squarish. Now, this is a labeled diagram of a natural tooth, that is an extracted natural tooth seen over here. Here also they are showing the mesoincisal angle and the distal incisal angle, and the crown and root is labeled with the cervical line labeling also is being shown in this picture. That is again a pictorial representation picture of a central incisor and lateral incisor. You can compare that to teeth. Going to the next aspect of the tooth, that is the palatal lingual aspect. So there are some characteristic features which is different from that of the labial aspect. And they say that it is considered to be the reverse of the labial aspect. So the characteristic features what you see in this aspect is a cingulum and a fossa. So you can see the cingulum is convex and the fossa is concave. So that is the reason we say that the surface is smooth, which has got convexity. Even though it is smooth, it has got convexities as well as concavities. So as we said, the convexity, that is the cingulum, that is situated at the cervical third, and there is a lingual fossa below that, that is again a depression. And when you look at the lingual fossa, that is a depression that you are seeing over here. This is bounded by a cingulum superiorly, nasal and the distal margin ridges laterally, and by the incisor ridge inferiorly. and the nasal and distal sides of the root converges at the root. That is again a pictorial representation of the same tooth from the same aspect. The nasal marginal ridge that is seen on the nasal aspect of the tooth, and the distal marginal ridge that is on the distal aspect of the tooth. You can see a lingual fossa, which is M-shaped, and there is a prominent cingulum. So you can see the prominent ridges over here as well as the cingulum. Incisal ridge also is, even though it's not labeled, that also is seen over here. So you can see the depression. That depression is called as the lingual fossa. And the tapering towards the lingual side is well appreciated over here. And the cervical line is similar, semicircular as that of the labial aspect. And here, not only the crown, even the root also is seen tapering towards that of the tapering towards the lingual aspect. The lingual aspect, the seen extracted tooth, that is a natural tooth showing all the features. That is labeled over here. Nasal marginal ridge, distal is not shown, cingulum, and the lingual fossa. All those are seen on this picture. Coming to the nasal aspect of the maxillary central incisor. So after the labial and the lingual aspect, it is the nasal aspect of the tooth. The crown actually appears triangular with the base at the cervical region and the apex at the incisal edge. So this aspect of the tooth has the fundamental form of an incisor. It is a triangle and or wedge shape with the base at the cervical region and apex at the incisal edge. As you see in the inset, the picture shows that. So the incisor ridge of the crown is therefore in line with the center of the root. And in this, we can also appreciate that the labial outline is convex with the crest of the curvature at the cervical third. And the lingual outline is convex in the cervical third. That is because of the presence of the cingulum, and then concave in the middle third, and then convex at the incisal edge. So the labial outline is convex, and the lingual outline, since they have convexities and concavities. Convexities are the lingual, the cingulum, and the incisal edge, and concavity is here. That is the lingual fossa at the middle third. So the cervical third also is convex, and the incisal ridge also is convex. Now, the crest of curvature, the crest of contour, both labially and lingually, that is seen immediately coronal to the cervical line. So since the crest of the curvature is just below the cervical line, this gives the crown the greatest labial measurement curvature. That is 0.5 mm in extent. So the bulk of the tooth is mostly felt at the cervical area. Now the cervical curvature of the cervical line is towards the incisal tip and is more convex on the nasal side. So nasally it shows around 3 mm depth, and distally it shows 2.5 mm. So that is the difference nasally and distally. So if you draw a line drawn through the crown and the root through the center that bisects the apex of the tooth and the incisal ridge of the crown. So if you draw a straight line, that is through the crossing the apex and the incisal ridge bisects. So that is equal division of the tooth into equal halves. So in this aspect, the crown is a triangular in shape or a wedge shape with the base at the cervical region. So because it is wider over there, as we said, the crest of the curvature, both the labially and the lingually, is mainly at the cervical area. So coronal to the cervical line. So the maximum, the greatest labial measurement is felt over there. And the labial outline also is convex. The labial outline is convex, and some places it is concave. Middle third is concave, otherwise it is convex. And the cervical line is bent. It is curved towards the incisal tip, and the curvature is 3 mm in depth in the nasal side compared to that of the distal aspect. This picture shows the extracted tooth, the natural tooth with that triangular wedge shape is shown over here, and the increased what do you say, wider cervical area, and the thinner incisal area is seen over here. So the increased curvature of the cervical line also is appreciated over here. Now coming to the distal aspect, so that is similar to that of the nasal aspect, and the crown appears slightly thicker from the distal aspect. Curvature of the cervical line is less pronounced. Now the maxillary central incisor, the distal aspect, you can see the raised curvature of the cervical line. Even though it appears bulkier from this aspect, but again the developmental depression is seen on the nasal aspect, but it is not visible on the distal aspect. Now the incisal aspect. In this, actually, the crown, again in the insect you can see the labial aspect, and the below that you can see the incisal aspect of that tooth. So the incisal aspect, you can see it superimposes the crown superimposes the root. So that is the reason the root is not visible over here. And the labial aspect, if you appreciate the labial aspect of the labial surface of the incisal aspect, you can see it is broad and flat over here. So the mesodistal calibration of the crown at the labial line angles is more than that of the lingual line angles. So that is the, and it appears convex near the cervical line, and it tapers towards the lingual, it tapers towards the singular. The mesolabial and the distal labial line angles are prominent, and the mesodingual and the distal lingual line angles are represented by the borders of the nasal and the distal marginal ridges, and there will be a marked convexity of the singular on the lingual aspect. So in this, we can actually appreciate the tapering of the lingual tapering can be appreciated here. Convergence towards the lingual side can be appreciated over here. So the triangular outline that reflects the outline of the root cross section. So this again, incisal aspect, it is more of a triangular outline is seen over here. Okay. Then that is again a pictorial representation of the incisal aspect of the tooth. This all the aspects are seen over here. The nasal, distal, labial, lingual, and the incisal aspect. All the five aspects are seen over here. Coming to the summary of the maxillary central incisor. Central incisors are also known as the first incisors. This is the widest teeth in the anterior segment. Now nodes are seen in the newly erupted teeth. There will be a sharp meso-incisal angle and rounded distal-incisal angle. Lingual fossa is bounded by cingulum superiorly, mesal and distal marginal ridges laterally, and by incisal ridge inferiorly. Crown appears triangular with the base of the cervical region and apex of the incisal edge. Curvature of the cervical line towards incisal tip is more convex than the nasal side, similar to that of the nasal aspect. Appears convex near the cervical line. Similar to the nasal aspect, the distal aspect is similar to that of the nasal aspect, and it appears convex near the cervical line and not convexity of the cervical on the lingual aspect. So these are the features which you need